And at these memorials, we would invite people from the private sector who had kind of been pitching on our side against drug use. And I would look at the list of invitees. One of the invitees my first year there was a lady whose teenage daughter had died from a methamphetamine overdose. And this lady, at her own expense, had for several years been going around the country at schools and at civic events speaking against drug use. You kind of understand. And I wanted to thank her for that, not just for putting up the expense, but for having to relive that part of her life. So at the reception following the memorial service for the agents, I went up to her. Leave something, I want to give you one more piece of background. When I found out that she was going to be there, I asked one of the people in the agency to give the background on what actually had gone on in her daughter's case. And it was like many drug cases that you see among adolescents, except the drug was a more serious methamphetamine, which is a very serious, very addictive drug. What had happened was the daughter had started out at age 14, just experimenting with it. And as is often the case with someone of that age, the parents will find out about it. And she had been sent to counseling, she had been sent to a psychiatrist. Things continued, downhill. There was an intervention. She went to one of these 10-step programs. None of this worked. It did not. Methamphetamine is extremely addictive. It did not break her addiction. Eventually, it got to the point where she did get arrested. And she was 16 at the time of the arrest. She did serve a very short period of confinement, was released, and by that time it was too late to break the addiction, and it was not broken. Within a few months of her release, she was dead of an overdose. Okay, I'm at the reception following this memorial service, and I went up to the mother who had been speaking in behalf of anti-legalization and drug criminalization to thank her. I did thank her for what she had done, and told her that the agency appreciated it, that I knew must be difficult, and that we were grateful. And I thought the response I would get would be, I'm happy to do it, these drugs are really dangerous, people need to know, they need to get the message, they need to be on the work. But that was not what she said. What she said is what turned me into a drug warrior in there. She just looked at me with a blank face, and all her grief had left her years ago. She cried as many tears as she was going to cry about this. She just looked at me with a blank face and said, if you'd arrested her earlier, she'd be alive today. Why didn't you? Now, I've been a litigating lawyer for a long time at that point. I considered myself to be pretty nimble on my feet. Always had an answer. You can't just sit there at appeals and kind of freeze. But when she asked me that, you arrested her earlier, she'd be alive. Why didn't you? I did not have an answer. I wanted to run away. That's what I want to do. You can't do that. I'm my position. So after what was probably a 10-second silence, it felt like 3 years to me. I said, we do the best we can do. We make mistakes. We'll try to do better. That's all I can say. Professor Berman correctly points out that drugs are dangerous, but they're never Professor Berman also correctly says, if drugs are legalized, there's going to be more consumption. The more consumption there is, the more stories there are going to be, like the one I just told you. Except there will never be a time in which we can arrest because no drugs are legal. If you remove the barrier to the use of tempting but dangerous drugs, the dangers they pose, the misery they create, and occasionally the deaths that they cause via overdose and via highway fatalities, which are considerable in number, are going to increase. That's going to be the cost. And the people who are going to pay it are probably the people in the poorest position to do something about it. Because the truth of legalization is that there isn't going to be, under no realistically envisionable system, is there going to be complete legalization of drugs. For example, minors are still being banned from using it, and the sales of minors is still being banned. I would hope that in a legalization system, that sale to either probable or actual addicts would be banned. Because addicts can't control themselves. They can't control themselves. And they will keep taking them essentially until they die. And that is the real end of the road for addiction for some of these drugs, methamphetamine and heroin in particular. So what we're going to have, we're not going to have complete legalization, and I think probably most people in the room would agree that we should not have complete legalization. We'll have only part legalization. The problem with that is that when you push one part of the system, it's not that the part that you didn't like goes away, it just changes, or it has a corresponding movement. So what will happen is that as long as there is any form of either criminalization or even government regulation, there's going to be a black market. It is going to distort the market, but it will not end the black market. There will also be the very kinds of police abuses, if you want to call them that, which people object now. Will continue as long as there is any form of criminalization. It will continue to be stings. It will continue to be wiretapping. There will continue to be doors busted down occasionally. It'll be the wrong door, and some completely innocent person will be terrorized. I acknowledge those are some of the costs of continuing to keep drugs illegal. Professor Berman says, well, the founders created for us a laboratory of democracies, and that's, of course, a federal society function. That's something that we can all be enthusiastic about, believing that the federal government is not, contrary to some people, how some people might visualize the current administration. The federal government was not created by the founders as a gargantuan, nanny state, an extremely expensive, if not bankrupt, blanket to cover, and eventually extinguish individual freedom. That's not what the founders had in mind. They did, as Professor Berman correctly states, have in mind laboratories of democracy. And indeed, we can look at what has happened to the extent of our laboratories of democracy, both in this country and abroad. What has been their experience with either a complete, mostly complete drug legalization or quasi-legalization? California, again, as Professor Berman correctly mentioned, California had Proposition 19, which would go very far toward legalizing drugs. Well, California already, in 1996, California passed the Compassionate Use Act, because that's what it's called, that partly legalizes marijuana, what is called medical marijuana. And they have some history with that. California is not the only place. It's been done. They also have medical marijuana in Colorado, for example. I know reading things at a talk like this is just deadly, puts people to sleep. But I do want to read you part of a letter that we got from a physician in Colorado. He was medical director of the Adolescent Substance Abuse Treatment Program in Denver. And he wrote about what the impact of Colorado's policies regarding medical marijuana had been in his experience. This is what he said. About 95% of the hundreds of young people referred to my clinic each year had problems with marijuana. I see teenagers who choose pot over family, school, friends, and health every day. When they're high, these young people make poor choices that lead to unplanned pregnancies, sexually transmitted diseases, school dropouts, and car accidents that harm people. When teenagers are withdrawing from marijuana, they can be aggressive and get into fights in state conflicts that lead to more trouble. He talked in particular about a 19-year-old patient that he had, who had been in there for severe addiction for a number of months. This is what he said. He recently showed up at my clinic with a medical marijuana license. How did he get it? He paid $300 for a brief visit with another doctor to discuss his, quote, depression, unquote. The doctor took a cursory look at his medical history and certainly didn't involve himself in contacting me. The teenager walked out with the paperwork needed not only for a license to smoke it, but also for a license permitting a, quote, caregiver to grow up to 6 marijuana plants for him. My patient, who had quit using addictive substances after a near-death experience, is back to smoking marijuana daily, along with his caregiver. This guy is not, this guy is not a cop. This guy is a doctor who originally supported Colorado's plan for medical marijuana. What did he get? We had experience. This is a man, was not on the DEA side originally, but what he got is not what he expected to get. What he got was not a laboratory of freedom. What he got was a kid who come close to killing himself before and is probably on the way back to doing it. We also have experience overseas. In the United Kingdom, some of the Scandinavian countries have tried it. And Scandinavia kind of was among the leaders, if you want to call it that, in drug legalization, or at least decriminalization. It was pushed first and primarily in Holland by a guy by the name of Ernest Bunting, who was also a physician. He was the Minister of Health in Holland and pushed for this decriminalization argument. A few years later, he decided that, well, it seemed like a good idea at the time. And this is what he said. There are young people who abuse soft drugs, particularly those that have a high THC content. The place that cannabis takes in their lives becomes so dominant, they don't have a place for the other important things in life. They crawl out of bed in the morning, grab a joint, don't work, smoke another joint. They don't know what to do with their lives. I agree experimentation in the abstract is a good idea. And it hasn't been just in the abstract. There have been, as I say, in culturally similar countries abroad and in places in the United States, there have been experiments with marijuana, even for its supposed medicinal purposes, which is, and that's the drug legalizer's best case. No one's really done. I don't think. Maybe there are. I'll find out from their questions what the people are talking about. Legalizing LSD, heroin, methamphetamine, things like that. Medical marijuana is the best case, but where it's been tried, the results, even from people who initially were in favor of it, have not been what they had expected, and they changed their minds. Again, I want to continue to talk, well, kind of probably to talk later on about some of the harder drugs, but again, I want to address the most difficult case from the perspective of a person like me who's against legalization. That is this medical marijuana. There is an ingredient in marijuana